as we go to the third domain, we are going we I introduced stressor, cancer as a stressor. We talked about the psychosocial well-being, support during the cancer diagnosis. We have to avoid the stigma of cancer, especially when we go out there in our society, that people will perceive things differently. They might hurt this cancer patient unknowingly because the knowledge isn't there, and of course, being the well-being and support during cancer treatment is what I mentioned. Of course, we have the psychosocial well-being, support in palliative care. Palliative care, I introduced it in a previous video up there. There's the psychosocial well-being and support during cancer treatment. There's the fear. There's what people go through. There's the big machine people will see. And of course, the previous point I talked about during the diagnosis, the chemotherapy, the changes that come about with chemotherapy, the body, where they will focus a lot on it. And of course, there's the anxiety and the fear under the diagnosis and during the treatment. Is the fear of surgery and all that. So that I already addressed. And so during end of life care, psychosocial well-being care, and care in life care, end of life care. This is the dying process. This is the concerns during end of life care. Among them is the fear of the unknown. So cancer patients die twice. Before they die physically, before the physical death, is the psychological death. Psychological death occurs when there's a lot going through these cancer patients' mind. The pain, one of them is the pain, who am I going to leave my family with? What am I going to do? The fact that they fear death, and the fact that they didn't have someone to work with, because cancer is it's a long life treatment, but with a positivity, the treatment may become shorter. And of course, we talk about survivorship, that you say you survived cancer, but on the other hand, there's the fear of reoccurrence, cancer coming back again. And of course, survivorship, psychosocial well-being and support during cancer survivorship. And we talked about the personal growth of cancer survivors, quality of life, and the fear of reoccurrence, management of symptoms under palliative care. We get to manage the symptoms, we get to know the common problems, and then there's the family assessment, get to know where the family is as of here and now, the role of family members, what are they going to do, who's going to buy food, who's going to take care of the security of the patient, and which hospital do they go, how are they going to raise the funds, and the common problems that are there in palliative care, getting to know what they may not understand what palliative care is, what it does, how is it going to help my loved one who is battling cancer. And of course there's the grief and bereavement. The Kubler loss, Elizabeth Kubler loss, Dabda, denial, anger, shock, belief, and then acceptance. We'll go through all that towards the end of all the 4 presentations. And of course, we've started domain 3. I'll tell you about it in the next video. So thank you.